I'm Dr. Elizabeth Geddes-Bruce, and I'm a board-certified dermatologist and cosmetic dermatologic surgeon, fellowship trained. I practice at the Westlake Dermatology location, Far West, and I'd like to welcome you tonight to our Avéli virtual experience event. Stay tuned to the very end because we're going to have a live question and answer session. Attendees can type their question in the question box and we'll answer each question individually. For those who attend the webinar tonight, you'll also be able to save $750 off the cost of your treatment, so stay tuned. Are you bothered by your cellulite? Cellulite affects over 90% of women, and the joke is the remaining 10% don't even know that they have it. If cellulite bothers you, don't worry, now we finally have a treatment that actually works. The Avéli device is one of our latest devices approved by the FDA to treat cellulite dimples. It's a little tool that goes under the skin and physically breaks up the tethers that create the cellulite dimples and uneven skin texture. We're so excited to bring it to Westlake Dermatology because it's the first of its kind that physically removes those dimples, and when we're done, we know that they're gone. We're not relying on heat energy from lasers to try and tighten the skin or do things that just temporarily stretch those bands. We get rid of them for good. Avéli is unique because it's the first device that actually goes under the skin and physically breaks those bands. In the past, we've used different laser devices, radio frequency energy, things to try and heat up the top layer of the skin and to stretch those bands, which can cause a temporary improvement, but not always attack it at its root cause. Now we have a device that can actually go after those dimples and make sure that they're gone permanently. Avéli is used to treat cellulite dimples. So the little dimples that we see on our buttocks that show through when we're wearing yoga pants or white jeans, or that make us feel self-conscious when we're wearing a bathing suit or even shorts. And it also works on some of the dimpling on the thighs. We just have to make sure that it's not skin laxity that you're trying to address, that it's actual cellulite dimples. If you are someone who's bothered by your cellulite, you're likely a good candidate for the Avéli treatment. It is highly effective and very safe and easy, almost minimally invasive. The device goes under the skin, breaks up those little bands. The Avéli procedure is relatively easy with very little downtime. We ask that you take it easy for a couple of days to about a week after the procedure, and then you can get right back to your normal exercise. Most of the time we see the results at about a month after the treatment, but they continue to improve over time.
Hi, I'm Dr. Heidi Prather, a board-certified dermatologist at Westlake Dermatology, and I'm here with one of our fabulous patients to discuss Avéli, our cellulite subcision device. Now tell me what brings you in today for a cellulite treatment.
Yeah, so I have a couple concerning dimples on my buttocks and then a couple on my lateral thighs.
And how long has these dimples been bothering you?
Probably for the past few years now. Tried a couple options, didn't really cut it for me, so I'm looking for something a little bit different, a little bit more permanent and more definitive.
I find in my clinical experience that 90% of women experience trouble with cellulite at some point in their life. And so we're always looking for these great options. And Avéli is the first FDA-approved device for subcision of the buttocks and the outer thighs. And so it's great for true cellulite dimples in both of these areas. What is really important is to differentiate cellulite from skin laxity. And the way I like to describe it is thinking of a button on a pillow. And so true cellulite is going to have a lot of branches coming from the skin, pulling down just like a string on a pillow, creating that dimpling in the skin. And we truly need a device that's going to go in, grab the tethers, cut and release them, allowing that skin to float back up to create a smooth appearance. If we have skin laxity in the area, that can make it more challenging to treat, but True Dimples are very responsive to this particular device, and we'll demonstrate how it works. When looking for ideal cellulite that's going to respond to the Avéli device, we want to look for dimples that are present at rest, and we'll mark out all of the dimples that we see that will be great to treat. You can see the cross lining will accentuate the depth where the dimple is pulling in and allow us to isolate each spot to release. After marking and assessing for cellulite on the buttocks, we have 7 dimples on the left buttocks and 7 on the right that we're going to address today with our Avéli subcision device.
Thank you for attending tonight's event, and we look forward to seeing you at your Avéli treatment.
Hi, thank you everyone for joining us and Westlake Dermatology tonight for that great video. I learned so much from you. I'm Dr. Heidi Prather. I'm one of the board certified dermatologists at Westlake Dermatology, and I work at the Bee Caves location in Westlake.
And I'm Dr. Elizabeth Geddes-Bruce. I'm also a board certified dermatologist, and I work at the Far West location in North Central Austin.
We're excited to have everyone joining us tonight to really talk about a hot topic that is near and dear to us as women, is cellulite. And this is something that has really been a burdensome topic because we have had limited treatment options that were efficacious and also reproducible until now. And it's great that we have this new device, Avéli, that allows us to really target cellulite and treat it at its root cause. Now we're going to go through some great questions that people have been chiming in and asking us. But this is a great topic that I'd like to have Dr. Geddes maybe share with us is what causes cellulite?
Well, what we know about cellulite is that it's caused by these bands that are under the skin and attach the skin to our fascia. And those bands over time, due to hormones or age or a number of different genetic factors, stiffen and contract and cause the skin to dimple in.
And we find that we see that in about 90% of women. There's a couple of great things that we also want to offer and highlight before we dive into all of these wonderful questions that everyone's sharing. If you're tuning in now and do have questions about the procedure, please feel free to chime into the chat box. But for everyone who signed up and is tuning in, we are offering some specials. Please stay on to hear this conversation because we will also be following up at the end with some exciting information as well. But if you do, give me 1 second. If you do sign up for a consultation with one of our consultants in the next week and decide that this procedure is for you and book before the end of January, we are offering an additional skincare item, which is really important, I think, to pair with these procedures. So the Skin Medica Firmentone Body Cream, which is valued at about $165 for that bottle, will be an extra freebie for you. And we are also offering some big savings.
Yes, for everyone who gets their procedure done, books it, and gets it done by the end of January, for everyone who gets their procedure done, books it and gets it completed by the end of January, they'll get $750 off the total cost of the treatment.
And what's the total cost?
It's $3,600.
So that's amazing. So under $3,000 and you can achieve a smooth butt. So we have some other questions about who would be a good candidate. And for good candidacy, really you need exactly what Dr. Geddes described, true cellulite. So whether that cellulite is on the buttock or on the outer thigh, if it's a true dimple that is adhering down, we can go under the skin, numb the skin, release it with this specific device. And that is a permanent treatment. This does not treat skin laxity or atrophy. So if there's other factors confounding it, there may be additional treatments that you may want for the optimal results. Now, we have a great question about the treatment. So Dr. Geddes, what does the treatment exactly entail and what can people expect for downtime?
Yeah, so when you come to get your Avéli treatment, you'll come to our office and we'll mark and take pictures. We'll mark out the cellulite dimples and then numb the area so that you're comfortable, and then use the device to go under the skin and break up those little dimples. And then afterwards, you use your own form of compression, something to just keep the area a little bit snug. You have about a day or so of a little bit of light drainage and no real downtime, actually. I found that patients get back to their normal activities pretty easily. What about you?
Yeah, I agree, because we're targeting just these dimples and it's really such a brilliant device. One question that came through is this good for severe prolific cellulite? And the answer is really yes, because if it's that deep tethered, it really needs to be released. And this particular device goes under the skin, grabs it, just like Dr. Geddes said, and almost has a little pair of scissors that we release. But what makes this unique is we can actually visualize the cellulite. So when we go under the skin and grab it, we can see it pulling and tugging. And that way we can go back and make sure all of those tethered bands are released. Because as Dr. Geddes-Bruce described, cellulite can almost be like the trunk of a tree. So there's all these branches, and just because we get one doesn't mean that cellulite is completely removed. Now, to prevent downtime, if you're an easy bruiser, you can certainly start surgical vitamins that can help decrease swelling and promote healing. I do recommend that patients bring in compression garments, whether that's just bike shorts or tight yoga pants, or they can purchase them when they come in, because I think having a little compression in that area can help with bruising and swelling. You can expect to be a little tender, and I do recommend that people take off from exercise at least for a few days. As long as you're bruised and swollen, you know that exercise is going to be uncomfortable, but second, might make that bruising and swelling a little bit worse.
Absolutely.
So Dr. Geddes-Bruce, tell me a little bit about skincare and how that might help either with the outcomes, but maybe also the downtime. Are there any products that you would recommend?
Yeah, I think anytime we do any of these procedures, we've learned that combination therapy often gives the best results. And so we love pairing good skincare whenever you get a type of procedure done. Things that have peptides that help tighten up the skin, good moisturizers, and there's all sorts of different ones that we carry here that I enjoy. What about you?
I agree. I think, a big component of this, and another question we got in is does it help tightness of the skin? No, Avéli alone does not address tightness. It only addresses those dimples, as we described in the video, about almost like a button pulling down on a pillow. That's what's being released. Now, if that pillow is wrinkly, we might need to tighten the pillow. If that button has been pulling down, i.e. that cellulite, for a long time, there might be atrophy of the fat, and so there might need to be some plumping to really help optimize those outcomes. But really, this is great for all ages. As we age, we get a lot of deflation of the bottom. We also get more skin laxity, and so a lot of times these additional procedures are more likely to be recommended with patients who are more aged in their skin quality.
Yeah. And I'm sure you do a lot of the adding biostimulatory fillers to help with skin quality, or some of our heat-based energy devices that can help as a complement to this device as well.
Absolutely. And I think that's another great question we got is what can this be paired with? And you led right into that. And so certainly if there's skin laxity or volume loss, we may want to consider, oil therapy or other tightening procedures, or perhaps Sculptra or Radiesse, which are biostimulatory fillers that can really enhance the collagen and support in the area. Oftentimes, Dr. Geddes-Bruce and I both love liposuction. It's a big part of our practices. As board certified dermatologists, tumescent liposuction was really almost bred and born by a dermatologist that still practices out in California, Dr. Jeffrey Klein. And so this is a big part of our everyday practice, is just facial and body global aesthetics and skin health outcomes. And when we're looking at contouring of the lower body, inner outer thighs, that's a really big part of supporting the buttocks and creating that hourglass shape. And sometimes even taking away a little bit of bulges in the flanks can augment and enhance the buttocks. And then removing that outer thigh can also create the illusion of this lifted buttocks. But oftentimes we need a little volume. So we've talked about Sculptra and Radiesse. Fat transfer is also an excellent option. And so if we're removing fat for contour, we can move it into these areas of cellulite dimpling and volume loss and pair that beautifully with Avéli. And those are some of my happiest patients, where we're treating inner outer thighs and then also enhancing the buttocks through volumizing with fat transfer and smoothing with Avéli and releasing those dimples.
Yeah, I think the important part is that the treatment really has to be customized to the individual, the issues that you have going on, whether it's just the simple dimples that the Avéli device can take care of, or if you're also battling some skin laxity or some excess fat, we've got ways to help improve that as well.
Yes. And we have another great question. And I think one thing that people are always concerned about is this going to hurt? So what are you doing for anesthesia?
Anesthesia is done with tumescent anesthesia, which is just a fluid that's injected very, very superficially, very diluted on the surface of the skin to make it very tolerable, very comfortable.
And everyone's a little different with needles. And so this is where we offer a little customization to our patients. I would say 99% of the time, patients don't need anything except for the injection numbing, but some people are just a little nervous. And so we do offer laughing gas as an option that can really take the edge off, but also just help you feel a little bit more relaxed. And what's wonderful about laughing gas, as well, it is an additional fee to use, you can still drive yourself. And so the laughing gas we use is self-titrated, wears off usually in about 5 minutes. So if anything hurts or you have a little anxiety, you can use it and then it wears off. So you're able to still drive yourself.
Yeah, and patients often joke that they wish they could take it home with them. It's a nice compliment to the procedure.
Mm-hmm. That and the Zimmer, our cold air during summer, is probably the other item patients love the most.
But sorry, just wanted to clarify, you're not put to sleep for this procedure. You are awake the entire time, and that's what makes it so very safe, but you're kept very comfortable.
The procedure time really should be about an hour, where you come in. Marking and talking about the plan is the most complex, important part of the procedure itself. And then once you're marked, you lay down, we numb, and we release. And it's really straightforward to get you dressed, put on that compression, and get you home. We have a question about drainage. And do you find that people are leaking at all after this procedure? And I ask that because we're numbing with a liquid solution. And so with liposuction, we do end up with drainage. What do you find your patients?
Minimal drainage, just a little bit. And it's just a little bit of pink tinged fluid.
And so with that, because we're not using a lot of the fluid, there's not a lot of fluid to leak out. Oftentimes the little incision might be left open, yes, or have a little stitch in it that would come out at a week. The procedure, how long does it last, Dr. Geddes-Bruce? If somebody is going to come in and treat their buttocks and or outer thighs with Avéli, what do you like to tell them?
The treatment's under an hour.
Mm-hmm. And then what about the results?
Oh, how long does the treatment last? The results that you have performed are permanent. It's just sometimes we keep aging and you might develop new tethers over time. But those ones that have been broken up, they're gone, and they're gone for good. And that's one of the exciting things about this device, is that we can get a visual confirmation right when we're doing the procedure to ensure that the dimple is gone.
Mm-hmm. And that's such a great point to make, that our bodies just change with time. And so oftentimes as we lose volume, our skin thins, we do unmask dimples that were there the whole time, we just never saw. And so certainly that can happen, but the procedure itself is permanent. It does not create or cause more dimpling. you do really want to see somebody who's been trained in this, because there are cases that if you treat something that is not true cellulite, you can certainly get outpouchings from the skin laxity. And so again, I can't emphasize enough that the most important part is creating that plan, marking the true cellulite, and releasing the right things. And so when done in that context, the results are very lovely and long lasting. We have a few more questions about treatment outside of the buttocks. So if somebody wanted to treat the thighs, how does that change pricing, or how would you recommend patients to address that?
I think for most people, the dimples that we're talking about primarily occur on the buttocks, but they can also occur on the thighs. It's something that you'll need to speak with one of us about so that we can address it and make sure that you're actually a great candidate for that particular dimple and this device.
Mm-hmm. And we have a lot of people who are trained and experts in Avéli within the practice. So if you don't live up by Far West, or in the Westlake area, I would like to make a little shout out to Dr. Atencio, who is one of our plastic surgeons, and she works out of our downtown location at the Four Seasons. And also Dr. Buford in Dripping Springs offers this procedure as well. And now we have some questions about off area. I typically don't recommend this for anterior thighs because oftentimes the texture changes we see on the front of the thighs are more related to skin laxity, and there are other treatments that tend to have higher yield results. And we have a question about liposuction. What do you think about pairing it with lipo, or if somebody's coming in for stomach lipo?
Yeah, I think not to do it on the stomach lipo, but if you're already there for a liposuction procedure, it's an easy add-on. It's a way to sort of maximize getting some great results and minimize the amount of time that you spend with us.
Yeah, and I think that's the easiest way, right? You're already in the room, you're already have your laughing gas and numbing areas, and this just kind of adds to that plan of really creating a comprehensive result, yes, which is really great. I want to emphasize too that for everyone out there, the next step, if you're interested in this procedure, is really to touch base with one of our consultants. To meet with one of our consultants, it's an hour visit with one of our experts who are trained in helping guide you through before and after photos. We have a lot of questions about more photos. That is your chance to see photos. Meet with our consultant. No charge to you. And if you book and meet with our consultant in the next week, and decide that this procedure is for you and schedule that in January, you will be receiving that free Skin Medica Firm and Tone body cream, which we do recommend as part of the pre and post treatment for this procedure for skin firming and tightening. And if you do book and treat before the end of January, we're also offering that extra $750 off of your treatment. Now, just a reminder, the treatment does only include the buttocks as your treatment area, and based on your evaluation by your consultant and your physician or provider that you choose, that can certainly be customized, but more areas may incur an additional fee. You will also be getting an email from Westlake Dermatology tonight after this webinar, emphasizing and reiterating how to book with a consultant and these specials that are going to be offered really just to the people attending right now. Dr. Geddes-Bruce, would you like to add anything for meeting with the consultants? I just think it's such a great resource that we offer as a company.
Yeah, no, I think you covered it greatly. The consultants are wonderful. They work very close with us. They're very knowledgeable. If they have any questions, they pull us in a room for a second opinion, and I trust them very fully. So meet with a consultant. They'll spend a lot of time with you and guide you if you're ready for the next step to meet with us.
Yeah, our consultants, I mean, I think all of them have been here at least 5 years. Yeah, so they're very well trained and have access to all these before and after photos. Some of them have even experienced the procedures, so can share some of their experience and their results as well. And I can't say how much I love this procedure. I think we need more and more options, and we're going to be seeing that, I think, in the near future with the new devices and technologies coming out for cellulite treatments.
Yeah, I think I just have a few other questions probably that are important to address. People were asking about, with it being, on your bottom, can you sit afterwards? Absolutely. There's no limitations on that. And asking about post-treatment discomfort. There's really maybe a little bit of discomfort afterwards, but definitely not pain. It's not a painful procedure. It's not a painful recovery. You'll have a little bit of discomfort, but that should be easy to tolerate. And the only other side effects to think about are you might have a few areas of firmness. I don't know if you've seen that. They can last up to about a month.
And sometimes it can be a little tender up to about a month, depending. It just gets a little sore in the area. Some of those tethers go pretty deep. And in terms of pain management, really Tylenol and Advil are the only things that you need to control the pain. It shouldn't be more than just a little bit of discomfort. Nothing that would require, being bedridden or taking time off work or any stronger narcotics or pain meds.
So there's no limitations on when you can get this done. If you've just had a baby, if you are cleared from your OBGYN to get back to life, you can have it done, I would say, even at like 6 weeks postpartum.
Mm-hmm. Yeah, I think the biggest limitation, and we both have babies, and getting out of the house. Breastfeeding might be a limitation. And so if you are breastfeeding after your baby, we are using lidocaine. And so some people will recommend pumping and dumping after lidocaine when breastfeeding. And so that would just be a consideration.
Yeah, and you can speak with your doctor about that.
Mm-hmm.
So as a reminder, you're going to be receiving a text message after the event, and please reply with the code word SMOOTH to be contacted for a consultation.
I love that. There's like no bigger motivation, right, than to take care and tackle our cellulite than the word smooth. So I think we've got some New Year's goals, and we're so excited that you would share your evening with us to learn a little bit more about why we get cellulite. It's certainly nothing to be ashamed of because 90% of women do have it and suffer from cellulite. But it's great to know that we're moving into this era where there's so many treatments that are available for us to tackle this nuisance.
Yeah, sounds good.
Well, thank you. Good night, everybody. If you have any questions, don't hesitate to reach out to Dr. Geddes-Bruce up at Far West or myself, Dr. Prather at Westlake. And please do meet with our consultants. Even if you don't end up booking Avéli, you will certainly learn something and you won't regret that time. Have a good night.
Good night.